Welcome, everybody, for the launching of the respiratory virus surveillance dashboard. Today, we want to share with you a presentation of the recently launched dashboard, and we're also going to travel through the contents guide and some practical exercises to use the dashboard. I'm going to turn it over to Mark, who will be introducing the webinar. Good morning. Hello. Thank you very much, Luis Fernando. I want to remind you that you have access to simultaneous interpreting into English, Portuguese, and Spanish at the bottom of your screen.
So I will speak in English and first of
Voy a
all,
hablar.
good morning to all and thank you very much for joining us today. It's my pleasure on the behalf of the respiratory virus team within the infectious hazard management unit of the PAHO's Health Emergency Department to welcome you to this regional webinar for the launch of our respiratory virus surveillance dashboard. This new platform represents a significant step forward in our collective efforts to strengthen respiratory virus surveillance across the Americas. It builds directly upon the data that you report every week through the FluNet and FluID templates, which basically form the foundation of PAHO's regional analysis and global reporting to WHO. In other words, what you will see today is not an external database. It's your data, systematically reported, validated, and now visualized in an interactive and user-friendly way. This dashboard reflects the collective work of our national surveillance teams, laboratories, and epidemiologists across the Americas, who continuously ensure the quality, completeness, and timeliness of the data that makes it possible. Through this new tool, we're trying to make this data more accessible and actionable to you in order to be able to support situational awareness, risk assessment, and evidence-based decision-making, both at the national and the regional levels. During today's session, we will walk you through the dashboard's main features. We will show you some practical examples, and we will try to engage with you to start using this dashboard. So we invite you to already connect to the dashboard. And we will discuss how this platform can also facilitate communication and regional reporting. We hope that this initiative will serve as both a resource and an incentive to continue strengthening the quality and the use of the surveillance data across the Americas. It's now my pleasure to give the floor to Luis Fernando, who will give us a tour of the dashboard, and I really invite you all to engage during this hour of discussion around this dashboard. Thank you.
Thank you, Mark. We're going to proceed with the virtual tour of the dashboard components. I will do this presentation in Spanish, but just a reminder, we have live interpretation in all 4 languages. So, empecemos.
We're now going to start with this virtual tour. As you can see on the screen, this is the landing screen of our dashboard. It includes 3 main sections I wanted to mention in the first place. This is the biological surveillance. This is where we have data from FluNet. As Mark mentioned, this is the data that you report region-wide through this platform. In the virological surveillance, we have laboratory data. In this section, we can interact using several filters to find the information that we need and create the visuals that we need. The first one is a date range filter that allows to choose an analysis period. The second is a subregion filter that allows to choose a specific subregion to observe more detailed data about the countries. And in surveillance, we can also choose observe all or sentinel and non-sentinel observation. On the right-hand side, there is a summary button. When you click there, it deploys a summary for the past and current years for each of the principal main viruses on this dashboard. As you can see, there's graphs for each region and trend boxes that allow us to see the recent situation. This is for influenza, and we also have data for SARS-CoV-2 and institutional respiratory virus, and also a tab that gives us the details for each country regarding the most recent trends. Next, we also have if you need help in navigating the dashboard, you can use the help. Uh, and the dashboard is available in 4 languages. You can click here, and all the visuals will be correspondingly adjusted. Now let's look at the virological surveillance page. The first box regards the levels of transmission of a seasonal influenza. This shows visuals to see the levels and the different thresholds that we have figured for each country using flu data. This first visual shows that there is a count by country, and the person status to let us know in what regions we see the highest levels of flu transmission. There's also a visual that allows us to see this by epidemiological weeks for the current year. This allows us to very clearly monitor influenza by week, by subregion, and we can also do this regionally. And also in this section that shows a very interesting table that gives us the country-based details with the rising or constant or falling trends based on the data reported in the last 4 weeks and the level of PISA for the latest reported data. This shows the trends and also the magnitude of influenza flu transmission by country. And then we have on the right-hand side the figures that show the number of countries that are included in each of the categories and each of the thresholds or levels of PISA. We can also activate detailed graphs by country that show weekly how the influenza positiveness is fluctuated and compared that to the various thresholds that have been established by the PISA methodology. The next page shows positive samples and positiveness percentage by week, and also by region and subregion for influenza SARS-CoV-2 and VCR for the same graph, which allows to analyze the virus that is presently in circulation and how has this evolved since the past stages. In the same box, we have a summary table that allows us to see the data for each of the viruses and for each of the countries that grouped by subregion. And we can use these filters, for instance, to activate the types and subtypes of influenza, selecting a different years or a range or a specific period of epidemiological weeks for a specific year. This box shows allows us to see the detail for each of the viruses. For instance, for the influenza, we can see visuals that show the positive samples as well as the percentage of positives by subregion or by country. And as you can see here, I see here the data by subregion. But if I should choose a specific subregion, like for instance, Central America, I can go to the details and see the positive samples and the positiveness by country. I can do the same kind of analysis for all the other viruses, like SARS CoV-2 regionally, and we also have visuals for VSR and other respiratory viruses. This concludes all the visuals that we have for epidemiological surveillance for virology. And now we're going to look at the section that shows the epidemiological data that comes from the Flu ID platform that is reported region-wise. This includes a box that shows data positive reported cases, both viral and ACT. And first box, we see the reported cases by virus that includes influenza, SARS-CoV-2, and VCR4 subregion, and by week. And on the right-hand side, acute respiratory infection and influenza type of viruses. This is grouped by subregion, but if we choose a specific subregion, like for instance the Andes, we can look into the by country and use this filter to choose any or data as we may require. Now let's go back to the regional level. The second box in the syndromic surveillance box shows the detailed data regionally for each country. And finally, we have a third tab that shows the around cases, rank cases, and the diseases. This can show the regional and country level. In the case, the on the left hand side, the R reported to uh, ICUs, and on the other hand, the number of deaths. And this can be also be filtered by virus, and this will show also the percentages. Now let's look at the third section of the dashboard. That's the country profile section. This has been decided to integrate the virological and syndromic data in a single panel. We can therefore choose a country and look at the corresponding data in an integrated manner. For instance, let's choose Brazil, which is Brazil in our filter, and all the visuals in this section will provide data for Brazil. As you may see, there is a subsection for virological surveillance. We can use sentinel, non-sentinel, or both. We have also these trend boxes by type of virus that allow us to have positiveness data for the last 4 epidemiological weeks. As you can see on this side, we have a box that shows the influence and positiveness for the 4 epidemiological weeks, and also the shows that there is a rising trend. On this side, we have the positiveness for SARS-CoV-2 and a downward pointing arrow that shows it's a decreasing trend. These boxes can be used to see what is happening in the last 4 epidemiological weeks, EWs, but in the following boxes, we can also check the same information. On the left-hand side, we can choose for a specific country positiveness for the 3 viruses, but we can also activate a panel that allows us to show the samples and positiveness on the same graph, and we can even activate this filter, use this filter for the last 4 EWs that shows the data for only the latest 4 EWs that is shown in these blue boxes. That's the trends in the last 4 EWs. And then we have design influenza to determine the present positiveness of influenza. That's a blue, and the average curve, that's a gray line, and we can also see the various data for the 4 EWs. On the right-hand side, we see the types and subtypes of influenza. We also have a pie chart that allows us to determine the distribution based on what we have seen in the graph, and we can also filter that for the data for the last season. This filter allows to activate the last season, and the graph will show only that period of time, and allows us to see the type or subtype that is in greatest circulation. We also have a graph for other respiratory viruses with the same visuals. The second subsection of the country profile subsection shows similar filters as we have seen in the regional section. We can filter by Iraq and Yeti, but we can also have these graphs that we saw before, but now they are filtered for the selected country. We have cases for virus and age group. And in the final section of the country profile, we have some stats about the percentage of Iraq that entered the ICUs, and the percentage of deaths in the last year for viral causes. And we also have data for epidemiological week by virus, and we also have the historical and how these percentages have changed in the blue boxes over years, over the over time. This concludes the country profile, and the idea, let me say it again, is to be able to see and integrate the previous sections. The last section in the dashboard is an information section. This section details the references, the data sources that include FluNet and FluID that come from our original hub, that's AMART. And here you can also have contact information for any kind of adjustment that you may require in the corresponding data. The dashboard includes all these interactive features. By this I mean that all the graphs are interactive. This means that you can use your mouse to check specific pieces of data like I'm doing right now. You can zoom in if you want to check a specific region in a graph, and there are other interactive capacities like we have seen in the maps. This place you can use your mouse to check the information directly, and you can use boxes to organize the filters and the information to create visualizations and the tables that you may desire. And finally, let me remind you that the dashboard is available in all languages. If you need to change the language, you can click on the language box, and all the visualizations will be refreshed to be shown in the desired language. Technical details about the dashboard that they should be aware of is that this dashboard will be updated every Monday on a weekly basis, and the labels under the name includes the latest update, and also we include here information since 2019. So for the data range filter, you can choose up to 5 years behind, and that'll show you the trends over that period of time. Thank you. Thanks for your attention, and this concludes the Dashboards of Virtual Tour. And now we would like to engage in a number of exercises. We're going to ask you a number of questions. We are going to create a couple of scenarios where we would like you to use this dashboard to answer some questions. The objective of this exercise is you will be able to use the dashboard and see how to navigate across it to answer these kinds of questions. For instance, we're going to share with you the link to the dashboard in the chat box. Please open that in a separate window and keep the Zoom in a separate window at the same time on your screen, because we're going to be use the dashboard to activate the filters, and we're going to ask you a question on the Zoom screen. Thanks also for your questions. We're going to be answering all your questions at the end of this exercise. As I said, we have shared with you the link to the dashboard that's in the chat box. Please open it. At the same time with the Zoom, we're going to ask a question in Zoom, and we're going to using the dashboard to answer those questions. Let's start with this scenario. First, using the dashboard to answer questions that we're going to be asking in these simulated scenarios. The first one is like, for instance, we are getting a request from a journalist that is interested in getting updated information about respiratory viruses that are circulating most recently. And this media person would like to have statistics and numbers about the present situation to identify the predominantly circulating viruses in the region, and also wants to analyze the most recent trends by types and subtype of influenza in the ongoing season. We're going to be doing right now is we're going to be using the dashboard to answer questions that are going to be asked by this person of the media, this journalist. The first question is, okay, let's have our dashboard ready. And the first question is, which viruses are predominant circulating in the subregions of the Americas? we can go to the dashboard and try to answer that question using the information that is available on the dashboard. You can see on the dashboard right now. You should be looking at a exercise one, question one, the first question in exercise one. And while we're using the dashboard, let me remind you that there is a dashboard section where we talk about positiveness rates, and there's an option there to look at the summary for the most recent year on the latest trends by type of virus. And there's also these boxes that allow us to compare or on a relative basis whether we are looking at a higher level than usual, whether the trend is upward or downward, upgoing or downgoing. We can also think where in the dashboard we can find a summary of the current situation. Okay, a couple minutes to answer this question. Very well. Are we ready? We're now going to share the results on your screens. You should now be able to see the results on your screen. And of course, this depends on the analysis we're doing. In particular, I see that most have identified influenza as the most predominant virus in the various subregions, but a significant number of the people have identified VSR and as a predominant in these subregions. And let's look how we could have used the dashboard to answer that question. If you will recall during the presentation, we went to the summary section. We visited the summary section that we can see in the first page of the syndromic surveillance page. Allows us to look at the latest data. I mean, last year and the year before, that includes boxes showing the trends in recent weeks and whether the level is higher than usual, is average or lower. We can use this summary section to answer these questions and quickly take a look at the various types of viruses. Alternatively, we could have used the positives by virus graph that we can see when the dashboard is just open. And for this question, we could use these two options and do our analysis for the most recent weeks. Very well, and now we're going to ask the second question in this exercise. Remember, we are in the same scenario where we are answering questions from a media person, and we have been asked what is the predominant virus in circulation in your subregion. For this question, please use the subregion where you're presently located, and use the dashboard to look at data from your own particular subregion and answer using the dashboard what is the predominant circulating virus at present in your subregion. We have already reported what is the regional information. Now we want to report on the sub-region information in particular. As you navigate through the dashboard, I think what elements of visuals in the dashboard allow us to look at the aggregated data for a specific subregion as well as the detailed data per country for a specific subregion, always on the dashboard. And do not forget that there's also these filters available to you by time, by subregion. You can use those filters to help you in your analysis and respond to this question. Very well. Another 10 seconds to answer this question. Ready? Very well. Now we're going to share the answers to question number 2 on screen. There is no one single correct answer in this question because each subregion may have a different situation at this point in time. And what you can see now is the answers that we have received. Let's see how we could have answered to this question using the dashboard. From our tour, we can see that there are certain visuals and filters that provide aggregated uh, data by subregion. On the left-hand side, we see how we could have used the virus type positiveness data for a specific region. This is in particular Brazil in the South Cone, and we could have used that graph to respond about the current situation in that particular subregion. Alternatively, we could have dive deeper by the sub-region and do a country-based level for the sub-region that we have chosen. I could have, in this case, for instance, choose on the right-hand side filter Central America, and that'll display the data for all the Central American countries, and I can then conduct the same kind of analysis. Very well.
I'm going to ask you to search the country that you are located on. We're going to do an analysis on subtype of influenza. Remember that we have certain charts that as a country we can see. As you see the dashboard, you need to check what section in the dashboard enable us to have a particular analysis per country, and also which chart provides information on types and subtypes of influenza. The question here is mentioning the right season in your country. So as you do that assessment, try to think about that. For example, you need to correct the right season or choose a period of dates. You can do that as well. We're going to give you a couple of seconds so you can answer this question. All right, so now we're going to share our results. We don't have a right answer. It depends on the country that you are choosing. But now we need to discuss the way that we should have answered this question. Now, going back to the main pages in the dashboard, we have the country profile. Remember that for the country profile, you can use the profile as well just for integrated data for your country. You need to choose the country of your preference. You're gonna find the viral features in circulation, and here you can see the subtypes of influenza. We can also see the distribution. We need to activate the data filter according to the last season. So by activating the data season, we are gonna predict what's the type of influenza currently under circulation. All right, so now we're gonna have a second exercise. The second exercise has the objective of answering questions related to the transmission rates of influenza. Well, thank you for your answers. And now we need to set ourselves in a second scenario. Now we're gonna ask you to follow up on a case analysis on the different levels of influenza in a region because we need to update our epidemiological bulletin up to 2025. Our goals would be to identify the regions that have high levels of transmissions. We are going to analyze epidemiological factors with higher transmission rates. We're gonna find countries that have ascending trends, and we are going to find or use the dashboard information in order to group these objectives. So after analyzing the transmission rates, we are going to go through the first question. Question number 1. Basically, we need to answer in which subregions is a moderate level of influenza transmission currently being observed. To answer this question, we need to mention a subregion in particular, but please remember that in the dashboard we have a session that talks about the transmission levels, and we have different graphs. We have graphs that let us see what's the situation currently. We can see analysis as a level of a country, and we need to see what subchart or chart as such we can use for determining which region has a moderate rate of transmission at the moment. So thank you for your answers. Please remember to use this poll. So farewell, we're gonna give you just a couple seconds. All right, we need to share our results. I am pleased to see that most of you have answered Central America. Now, let's discuss the way that we should have answered by using the dashboard. As you can see, we have an opening in a side with a box devoted to the transmission levels, and definitely we can answer the questions. As you can see, the data in this chart is grouped by subregion, and we can see how many countries are located in each category. For example, we have extra, high, moderate in orange. We have the low threshold and the basal mode in green. As you can see, all of these countries can be classified in such levels. But for the week that we are in right now, we can observe that in Central America, we have a country with moderate levels. These graphs or charts enable you to have a quick glance at the last reported data. And we could see, in a way, like a draft level, what's happening with each country or each region. Now, let's go to our second question. We want to analyze during which epidemiological weeks were the highest level of transmissions recorded in your subregion over the past year. So please try to use the subregion that you're currently located in because we want to analyze throughout time. we want to analyze what weeks showed highest levels of transmission in your subregion. Of course, this is of the present year. If you go through the dashboard, you're going to see that there's a chart that enables you to see throughout time. You need to find your subregion and you need to analyze the epidemiological weeks with the highest levels. In this case, a high level would be above basal levels, which would be green. And to answer these questions, you need to set a range of epidemiological weeks. You could pick 1 week in particular. So we are trying to use the weeks that could be of interest for us. We are going to give you a couple seconds to respond. Very well. I'm seeing that most of you are just finishing and analyzing the weeks. And remember to use your subregion. We're just going to give you a couple of seconds so we can share our answers. So now we're going to share the responses. We need to analyze the way that we should have used dashboards to answer the question. Now, let's continue with the analysis. Thank you for answering. As you can see in the session of transmission levels, we have a graph that enables us to observe the variation of the thresholds according to the amount of reporting countries. As you can see, we're going to use the example of Brazil. We select this type of chart or this part, and we are going to be able, with the help of the features, to analyze where are the highest levels beyond the basal rate. So with the PISA methodology and the colors, we're going to easily do an analysis and determine how many countries are in such categories. And actually, we could use LGX to determine which weeks, but it will be aligned with the subregions. This graph or chart enables comparison between regions. Now, let's go through question number 3. For question number 3, we need to answer which country or countries are showing the highest and increasing levels of transmission. This is a 2-section question. We need to find levels of transmissions, which could be high as a country. Remember that we have a side of the dashboard that enable us to identify what's the category, the level, and we need to find the ascending trend countries over the last epidemiological weeks. It's a long list, actually. We're just showing some countries there, but based in countries like Canada, Jamaica, Salvador, Panama, Chile, or different countries, you need to use the dashboard to identify which countries could actually have this pattern observed in the transmission levels. As we build this analysis, there's a section of the dashboard that enables us to look at this information, and it is important for us to consider direction, magnitude. We need to find the analysis per country. We need to find the transmission level, the current one, and the last observed trend. Okay, so I see lots of questions from you. Thank you. Okay, so now we need to share results. I can see that many people mention Canada, El Salvador, Panama, Colombia. Many people have chosen Chile, and some people said, I don't know how to find it. We have most of people that have chosen Canada, El Salvador, and Chile as countries that have high trends for transmission. So let's see how we could have used the dashboard to answer this question. By using the same section of transmission levels, we can observe that the third sheet here lets us see both variables. So we can observe a trend and we can observe the PISA level that we have had over the last week. And I want to go into detail what we can find in this chart. As you can see, we have a trend, we have a red arrow saying that this is going upwards, and we have a green arrow that can show that this is going downwards. So for this question, we were finding the ones that had the red arrow. And as you can see in the graph to the right side, we could see a trend over the last 4 weeks. So we can quickly observe that a country has an ascending trend. At the same time, we need to analyze the threshold that we're currently in, and we could have done that by using this section in orange. As you can see, if we click, and I'm going to show you in the dashboard, but we can actually click and organize the columns. And we have countries with lower levels, but with an ascending trend. We have Panama with a moderate level, but it has a descending trend. And El Salvador and Chile has an ascending trend. That's why they are beyond the basal level. And this is a data that was reported in week 41, as can be observed in the last column. So now I'm going to share my screen with you, and I'm going to mention how we could have obtained this result by using the chart and filters on the dashboard. As you can see, in the third vignette, you could see that we have transmission per country. So we could actually click on the names on the column, and we can organize the information alphabetically or by different categories. We can also organize by the PISA level. We could use basal level, descending way or method, and we could find the countries that have higher trends. Another way is to organize per trend. If we click on the name of the trend, we could actually group and organize and that would enable us to see which countries are going down. So we can click here, check the countries, and review the levels. A new option would be doing an analysis per subregion. We could have select Brazil, for example, and the South Cone, and this could actually activate the charts per country. For example, we could identify that we have ascending countries, and Chile could be in the lower levels. That could be helpful to identify furthermore. For example, we could find countries like El Salvador and Chile. And remember that in the profile of the country, we have a possibility to consult the PISA chart individually. So in this section, for example, I could search for El Salvador. This was one of the countries that we located in the chart as ascending, with levels that were higher than basal. And in the positive influenza section, we could see the chart per epidemiological week. As you can observe, we can check the current week of the year, and in the gray area, we could see a average curve. We're going to be able to see that El Salvador has surpassed the yellow level and currently is having an ascending trend. I think that the average curve enables us to see the usual behavior, and from then onward, we could do an analysis according to the situation of the country. Actually, that level is to be expected for this type of or season of the year. If I want to go to Chile, I choose the filter, and I want to be observing the same thing. In the blue curve, we could have data for the current seasons, and we can see that Chile has an ascending trend, and it's currently in the lower threshold, but we can see that soon it's going to come closer to the moderate level. So we're going to be able to use these charts to find more information. That's why we have the country profile. But I'm sure that we can start from the general to the specific. Okay, so let's go back to the exercises. For the next section, Tania is going to help you to continue with the communication exercise, and we're going to have a question dynamic as we were just doing. Thank you, everyone. My name is Tania Escamilla. I am a specialist in communication of the Emergency Risk Department in Washington. We're going to do a small exercise for risk communication. You don't need to check the data to do this exercise in the dashboard. Basically, this would be guiding questions that would help us see in what way this data could help us in a functional way to care for some risk communication aspects, because sometimes we see that from the technical side you need to have accompanying of a professional communication professional, but we need to acknowledge that by assigning communication professionals from our areas, that could be of great value. So that's why I would like to invite you. So if you have the possibility, you could give that information of this new dashboard to professionals working in risk communication within their teams. We're going to do every exercise in order to integrate the data offered by the dashboards that could help us to strengthen the capacity within our institutions. We have the English slides. I'm going to be speaking in Spanish, and you're going to be able to see the questions of this exercise in both languages. If we discuss the scenario for these questions, we have rumors circulating on social media detailing that there are several deaths of older adults from seasonal influenza in their country. In light of such rumors, a journalist contacts you or the Ministry of Health to confirm this status, and he has made a request on what's the current situation on respiratory viruses, which are the most predominant, what would be the trends, and what type of influenza has been the most dominant, in order to understand what's the cost of this people that have deceased. And the audience will be general public. So thanks to the dashboard, you will have an updated data, and you're going to be able to follow the preventive actions for each community. We are going to ask you 3 questions so you can decide how are you going to communicate the information that you're being demanded for. Okay, so first question. The first question could be, what would be the best way to communicate to the public the current situation? We would like to highlight, of course, that there is current influenza and recent influenza trends. And we need to remember the importance of having a inclusion of science. We need to translate the data as preventive action. So the overall public needs to have a relevance that could be according to the capacity of the public. Because in risk communication, we try to center this through a preventive way to save lives and avoid any problem or any patients that could have serious illness. So the first option is to define a technical profile with a specialized terminology with the general public, and the second option is to include social media messages without including preventive information. We need to communicate a clear notice that could be brief in social media, but pointing out the trends. We need to publish a clear and brief message on a website, avoiding to communicate the information on a trend on subregions, basically. I have seen that many of you have answered the first option, which is including an institutional response by highlighting the trends. So I believe that in a sense we could update this for general public on preventive measures. And that could be the most suitable response in this scenario, because if we share this with the population but we don't share the responses, we are falling short. And if we report a technical document, we know that most people are not going to be able to understand. So the technical information needs to have such adaptation for the general public. Now let's go to the second question. The second question let us know about what element is essential to warranty that communication on respiratory virus could be suitable. So we have four options. For example, we need to see what's the relevance of the data. We could be having data that we're using in new crises that we could find in our countries. The first option is to present only numerical data without interpretation. The second one is to use simple messages, avoiding technical terms. Third would be publish information only on specialized technical reports. And the fourth includes only graphs without textual explanation. And 100%, I am pleased to say that 100% is happy to use simple message without technical information, and that would be one of the features that is relevant for risk communications, and that's important that we all consider this for such influenza station. We have opportunity to adapt this in our messages, and let's remember that these messages of risk communication could actually show a fundamental role to have scalability on social measures and public health measures, such as preventive actions that we could take. So it is important that people could understand the actions that they're being communicated for to be able to follow these recommendations in the reliability towards authorities and institutions.
Now we're going to move to the third question. That is the last question in this section. And the third question asks us what is the best strategy for responding to the request from the person from the media. The first option is to provide updated data accompanied by contextual information and the preventative measures that be undertaken by the population. To secondly, share incomplete information to respond as quickly as possible. And responding with only the data that is available at this time. The third option is to avoid mentioning recent trends to avoid creating a sense of alarm. And the fourth one is to respond without coordination with the technical team to validate the information. Many of you have answered that it's best to respond providing updated data accompanied by context and preventative measures. And this is the most appropriate option. We are aware that in the midst of an emergency that can arise because of the appearance of cases during the influenza season, there may be some uncertainty, but this uncertainty has to be managed in a way that will not create among the general public. So our recommendation is always for those who are writing press releases in an uncertain context is to always include preventative measures to mention what is known and mention the trends and also to underscore the call to action for the people. This is key in all cases. In the case of a risk mitigation, this is one of the most powerful tools that are available to us, and we always must communicate these measures in a way that will be well adapted to the social context of the communities that we work with. This was the last question, and thanks very much for participating. And I would like to turn it back to Luis Fernando to continue with our webinar. Thank you very much as well. Really, the webinar is about to conclude. We thank you for your time, and we would like to know very quickly if there are any pending questions. But otherwise, you can also send an email to flu at PAHO so that we can answer to all your questions. The only question that I've seen has to do with downloadable reports, and I wanted to mention that we'll be adding automated reporting that'll be downloaded in a PDF so that you can have an offline printable version of the data. And likewise, let me remember that in the dashboard, the data tables that we send are also in Excel format so that it can be downloaded easily. Thanks very much for your time. And I'm now turn to Mark for the closing remarks. Thanks very much, Luis Fernando and Tanya, because I feel that this exercise has been particularly helpful, and thanks to all of you for participating in this webinar. And we expect that this section has allowed it to know better what are the functionalities and the data sources that are used for this dashboard, as well as the analysis options that is provided by this new dashboard. We would also like this dashboard to be a living tool that will evolve according to your needs in your own countries and also throughout the region. And for this reason, we invite any that might be interested in contributing to their continuous improvement to join a committee to this dashboard continued improvement. Will be getting a link for the service, and you can include your email if you're interested in joining this improvement task force. Thanks very much to all the laboratory and surveillance teams in the member states and the continued support from our country offices, the PAHO country offices. And having said that, we conclude now the webinar. Thanks very much for your time and your commitment and your cooperation in a strengthened respiratory virus surveillance throughout the region of the Americas. And have a great weekend. Thank you.